Now, with me, Dr. Leana Wen, former Baltimore Health Commissioner. I listened carefully to much of the testimony. There's no middle ground here. The Secretary says he's basically improving America's health. Most of the panel said he's not. Where does it go from here?
Well, I find it hard to see how you could improve America's health by dismantling the public health infrastructure, by sowing doubt into the people who work for federal health agencies, and by essentially turning science on its head. The way that science is supposed to work is you have a hypothesis, you get data, you test that hypothesis, you're willing to admit if you're wrong. But this is kind of the opposite of the approach that Secretary Kennedy takes, which is he seems to have a predetermined conclusion that vaccines are somehow toxins and dangerous. And then he's cherry picking data to fit that conclusion. And he's also choosing people whom are in lockstep with him. He has already fired all 17 members of the advisory committee to the CDC on immunization policy. And there has been massive upheaval in the CDC itself, with the CDC director being ousted, multiple senior leaders resigning. And I think that we're seeing a situation where we will have effects on vaccine access. We're already seeing an increase in vaccine misinformation being spread, including by Secretary Kennedy. For example, he was at best lukewarm when we had the worst measles outbreak in the US in 30 years.
So, but the Secretary gets to keep his job as long as he enjoys the support of President Trump. And that seems to have been the Faustian bargain that was done for Trump to be able to say, I've got a Kennedy on my team. So it doesn't at the moment look as if the Secretary is going to be departing.
Well, I don't know. I certainly can't say that I know what's going on in President Trump's head. But by all accounts, they seem to have a cozy relationship. It does appear, though, that there are fractions with Republican lawmakers. As you mentioned, and as we saw today in the hearing, we saw prominent Republican lawmakers, including Senator Bill Cassidy, who is a physician himself, really express concerns about what this limitation in vaccine access and this misinformation around vaccines is going to do. And frankly, we know what will happen. We've seen many examples in other countries of the return of preventable childhood illnesses. And I think it's mind-blowing, because on the one hand, Secretary Kennedy says, okay, he wants to focus on chronic diseases and reduce the rate of chronic diseases. But I don't think the way you do that is by getting more people to fall ill from infectious diseases and getting people to die earlier in life. You could cut chronic diseases that way, but surely that is not the recipe to better health.
Dr. I'm grateful for you tonight. Thank you.